listeners. Welcome to another episode of the Chris and Podcast. Thank you for tuning in. Today is going to be a slightly shorter episode. I've got my amazingly wonderful Master of Science wife coming on today to help me narrow down the real meaning and functionality of trauma. Kim, thanks for doing this.
Thanks for having me.
I hope the drive wasn't too bad.
Not terrible.
I talk about trauma all the time, and I feel as though I have a grasp on it. But the thing that I know about it is more of like recognizing that somebody has trauma versus how it like manifests and why it latches on to like what. I'm trying to think of what part of your memory core.
Well, it affects your oblongata.
Oh, really?
Mm-hmm. So it sends you into like a fight or flight response.
Okay. That's kind of what I thought was happening, but yeah, it's just the concept of like one really intense thing can cause somebody a bunch of trauma and not affect another person.
Yeah.
Like we've seen some things that other people would absolutely lose their mind if they saw. But yeah, so like have you seen like the range of how
Yeah, I think
makes sense
so.
where I'm going?
No, yeah. Yeah, I mean, I've even told people stuff that's happened in my life and they're like, "Oh, like they're just baffled that it doesn't affect me." I think a lot of people too that work jobs where they see physical trauma happen to people, I don't know if they get like immune to that. If their fight or flight just doesn't go off anymore. Like if you think of first responders, law enforcement, the things that they see, or, you know, paramedics and all that, I don't know. And I think, yeah, eventually their body just gets used to it. And so they don't have that flight or flight response anymore.
Desensitized due to repetition.
Which is interesting because that's one of the treatments for like PTSD or, you know, for traumas. What exposure therapy.
Exposure therapy. That's what I was looking for. I've tried remembering before, and I could never remember I always wanted to go like immersive something or other.
Well, you're immersing yourself into your trauma.
But yeah, when people go in and because I've talked to a few people who say like you go in, you tell the same story basically over and over, to the point to where you get super frustrated, and everybody that I've talked to sounds like they give up. They're like, I'm just sick of going in and telling the same story over and over. So listeners, if any of you have gone through that treatment and had a positive experience, would love to hear it. Comment below. Maybe we'll have a chat with you. As far as your trauma goes, because it's weird to like have such a grasp on trauma, knowing that we both have like traumatic pasts.
Yeah.
But when we hear about other people's trauma, we look at it from a resolution perspective as to like, at least for my brain, when somebody starts to tell me a story, I go, okay, so when they see this thing, this probably starts to happen. And I start to verbalize that. So I'll be like, okay, so like when you see that the road is wet, that probably starts to raise your anxiety. And that's how I attack somebody else's trauma. But with my own trauma, I just go, it happened. And it just kind of goes away.
Interesting. So there's nothing that really triggers anything in like an intense amount of anxiety when you're exposed to it.
Not anymore. And that's what I'm curious about is like, I wonder if I've just thrown myself into, and that's part of the codependency thing is like, I have to figure out, I have to decode your trauma and figure out how we got to this place. And because a lot of times when people talk about trauma or their personal trauma, it's like they will list like symptoms that they have, but not recognize that they're associated with each other. And so like when I hear somebody say, you know, like the wet road thing, for example, somebody gets stressed out when they know that it's going to rain, and but they'll say like when it rains, like my heart rate goes up.
Yeah.
So I think they associate it with something else though. Like rain is the thing, not the car accident that I got into.
Yeah.
Rain just
Yeah.
stresses me out.
Yeah. I wonder
know
if
what I'm saying?
that's like, I know we like laughed about me having like a panic attack in the car wash, but I really wonder if, I don't know what my fear is, but I watched my pulse on my watch go up 20 beats per minute while we were driving into it and sitting in it.
Well, your thing is like it's a mixture of like claustrophobia, but a complete lack of control.
That's, yeah.
So, I mean, that entire experience, yeah, when your brain starts to overanalyze all of the machinery that's in there, yeah, it could absolutely drive somebody nuts.
Yeah.
And even if you wanted to get out, you don't know what would happen if you tried to get out.
Yeah.
What if my car doesn't start? What if it...
That's the whole thing. My
yeah.
car is going to break down in here. I'm not going to be able to get out.
Yep.
Yeah. The machine's going to break. It's going to land on me. I have a child in the car. It's going to break something on my car.
That's interesting. I wonder if we could figure out your thing being...
It was my childhood. My mom even remembers me screaming in car washes.
Yeah.
So I don't know what it is. There's some claustrophobia type stuff too. I don't like tunnels. I don't like...
But there's a consequence. So it's a foreboding. A car wash is a foreboding of a bad thing that could happen.
Yeah.
So like when you sense like a bad thing coming, if it's something like confrontational wise, you have certain defense mechanisms, getting angry or leaving the situation, disassociating. But like you tend to... There's like there's a switch that goes off when, like I said, like there's something coming.
Mm.
And when you're in that car wash, there could be something coming at any fucking second.
Yeah.
Like when company's coming over, you have this switch flips and you go, uh-oh, there's this big storm coming to my house. And if it notices that anything is out of place, then that's going to destroy my fucking self-esteem, and they're going to judge the rest of my house and how am I raising my kids and all that shit.
Yeah. Which is funny because I don't judge other people's houses.
I know. Nobody does. Unless your house is gross.
Yeah. I've been in some gross houses.
But even then, I don't really care.
They're usually gross people, so it makes sense.
Exactly, yeah.
Yeah.
It's like, of course.
Yeah.
Of course there's sardines on the counter.
Yeah.
But so from your understanding of trauma, like what why is it that it stays?
Because your body, I don't know. That's a good question. I don't think you'd process through it, or you don't work through it, and your body still holds on to it. I thought about that too when you're like your past traumas, because I used to remember that car accident we got in.
Yep.
With the kids. I used to for a long time, I could still smell the airbags because it's a very distinct. Yeah. And it's interesting. I thought maybe I was losing it, but your mom was in a car accident, and I asked her about it, and she's like, yeah, it's like, but I could just smell it for a long time after.
What's that called? Your something sensory? How like smells trigger?
Yeah.
I can't remember the name of, like, you have X amount of sensors that will trigger memories.
Yeah. So, and then, but what's interesting is your brother moved down that road. So I had to expose myself, because before, when I would go visit my parents, I would avoid.
Wow. Did they move after the accident?
Mm-hmm.
I didn't even think about that.
Yeah. So I would try to avoid it when I'd go to my parents' house. I'd just take the other way down. But then when we lived on that road and then your brother moved there, I was like, I'm going to just keep driving it. And it took a while, but I could feel like my heart rate increase, and I would get really anxious driving through.
Is it still a landmark?
Yeah. What do you mean? Like, I know it's coming.
Yeah, that's what I mean. It's like there are certain things on that road that will always stick out whenever I drive down it. There's that one open field that has like a little creek that runs behind it. Always a landmark in my mind. There's that red house that's always a landmark in my mind. But I second guess whether I'm actually at the spot where the accident happened or not.
Mm.
I always, if it does cross my mind, the feeling of I'm standing in the driveway alone, and it felt like everything was so far away. And in that neighborhood, you have that field right there.
Mm-hmm.
So it's like everything just zoomed out, and I was like, fuck, I can't just run over there. I have to grab the keys. I have to make sure Barley's in the house. I have to so I have this, I want to be there like now. I don't like a lot of things that are far away. And I mean, that's why I always prefer having the kids here versus mom and dad's, is because that's so far away. If something happened,
Yeah.
I'm so far away from them. Half an hour is too long, even though it's, a half an hour out of a day is nothing, but it just stresses me out to no end. So that's the thing that I think of when I think of that accident. But so does it still, do you still get like a little flutter or anything? No. It's just
I thought
one of
about
those things.
I thought about it when I drove there last Saturday. We were driving through that area. Like, I don't feel anything anymore. Like, I just exposed myself to that spot so many times and forced myself to, because I had to, or else I'm spending an extra how many more minutes driving a different route, that I'm like, no, well, it happened. It's awful. I hated that. But
so people who are exposed to like repetitive trauma, like somebody who's in a house that's not safe, relationships that aren't safe, because we're talking about situational, like one-time things that just stick out because it's so different from everything else. Mm-hmm. But when somebody's trauma is day in, day out,
like the child abuse stuff.
Yeah,
that's lots of psychotherapy. I don't know if exposure therapy. I don't know a lot about it. I can't imagine that that's going to be helpful for someone who's had prolonged trauma.
Yeah,
like veterans or people who are in the military. I can't imagine that exposing someone after they've been exposed to the similar trauma for a period of time would be. But I don't do psychotherapy, so I don't specialize in that, so I don't know. But
so your role is to, because whenever I bring up empath to other nurses, they're always like they get the word.
Yeah.
But
it's an acronym.
Oh.
So it stands for Emergency Psychiatric Assessment, Treatment, and Healing.
I see.
Yeah.
Okay.
So it's an emergency psychiatric unit where we do assessments, we do treatment, and then it's a healing environment.
Okay. So would the empath unit kind of be like a waiting room?
No.
Because don't they need to go someplace else after they're with you?
Not always. They can discharge home.
Oh.
No. We're just like an extension of the emergency room.
Okay.
So they come into the emergency room. The ER provider does all the medical stuff. They do the clearing, and then there's a conversation between our providers. And then if they're a candidate, they would come up to our unit to finish that assessment and that crisis stabilization. So that quick, psychotherapy, seeing our psychotherapist, seeing our psychiatric provider, and coming up with a plan while in a healing environment that's not that chaotic emergency room.
Okay. So you're making sure that all of those things are there and available for these.
Yeah.
Okay.
Yeah. I mean, it's not always like that. Sometimes our psychotherapist is seeing other people and all that. So it's not like they come up and these things happen. First, they see our mental health nurse and they do an assessment. Then they provide that information to the other people and they kind of come up with a plan. So if someone comes in for anxiety, we know what kind of things to work with, helping them find more coping skills.
Okay.
Or, if they're having issues with sleep, giving them stuff about sleep hygiene, stuff like that. So kind of figuring out what issues are kind of going on. Sometimes it's relationship issues, losing a job, losing a relationship, where you can work on grief, appropriate grief.
So you kind of have a generalized, I'm trying to keep this as vague as I can, but a generalized plan for the situation.
It's always patient specific. I don't know. It's hard to say.
But I mean,
we have educational materials.
Okay.
Like worksheets.
But for you though, because you've seen it a lot of these things so much.
Yeah.
you see somebody that comes in with, potential PTSD or like vulnerable adult coming in and they seem to be easily triggered.
So I think a vulnerable adult a completely different way than what you're stating it.
Oh, okay. What do you think?
Vulnerable adult is essentially an adult who is unable to care for themselves.
Yeah. No, I was saying the same thing. So for whatever reason, they don't have the individual who normally helps them, or that person has said, we're in a scary spot. And we're bringing him in or him or her in because of this.
Okay.
And they're being, they're getting either scared or agitated or whatever, like really quickly.
Because of a trauma they experienced, or
potentially because of a trauma they experienced, or escalating. Like things escalate really quickly with them.
Mm-hmm.
It's either very scared, very numb, this and that. Like, what are where does your brain go when you hear stuff like that?
Well, obviously it depends on their assessment. Sometimes they talk about what is causing that fright. Like, I always try to figure out what's going on prior to you being afraid. What's going on prior to you feeling this? Sometimes people just feel like they're coming on, but what is going on in your mind, or what is going on around you prior to you feeling frightened or becoming agitated or so on and so forth. Sometimes people can identify, oh my gosh, I heard the song, or I saw this thing. And then, but sometimes it happens so quick, people don't realize it until you ask or try and go back.
So is there somebody that's trying to figure that part out usually before they come on? Or when they come on, do you guys?
Yeah, no. It depends. It's hard. We're in such a transition stage right now. It's hard to talk. Usually psychotherapy or nursing will ask a lot of questions too.
Okay.
It's not like this person does it every time.
Okay. That's what I was trying to figure out is, okay. Yeah. I mean, I guess it is so new. Trying to get that shit together is a nightmare. But the end goal is to have like
a plan in place.
Yeah.
Yeah.
Okay.
Yeah. Whether it's like setting them up again with more resources, or doing that crisis stabilization and figuring out what next plan of care is.
When you were working with youth and adolescents, there was one case where you were able to talk with, or they'd written you a letter afterwards. So I'm trying to remember, because most of the people that you see, you don't get to see the end result.
Yeah. I had a patient who went to a longer term care after and sent the unit a letter letting us know how they were doing. And that was nice, because I think mental health is so hard because you don't see what happens after you send them to wherever they go. Like, you hope they get better. That's the goal, but you never know. And I think kids were really good about sending us letters and letting us know how they're doing. Adults, I do follow-up calls with people, so that's a rewarding. I get to do a follow-up call after.
I didn't know that.
Yeah, so after they've been on the unit or after they've discharged, usually, and it's people who discharge, they fall on my list, and usually I call and see how they're doing, and if they've made it to their appointments, or if they picked up their medications, if they have any questions, if they have any suggestions or comments, things that we could have done better, things that did go well. So that's nice. I get to hear things then.
Do they typically have the capacity to answer questions like that? Oh, okay.
Yeah. That's if they answer.
If they answer. Right.
Yeah.
So.
But kids, that was reward. I still have that letter.
Yeah.
Yeah. It's just something, it's just nice. I think that's why with you, I always let people that were part of your care know how well you're doing, because we don't hear the good things. Okay. Like, you can work on a telemetry unit and someone came in with a heart attack and you get them set up and they're good and they're stable. You get to discharge them and see them. You saw them at their worst. Now they're really good. It's like mental health is so hard because, especially with meds take a period of time to start working. So you hope you send them home on the right meds and that they follow up and they're doing well. Mm-hmm. But you can work on.
Do patients ever go from empath to the adult unit?
Mm-hmm. Yeah.
So are you guys allowed to go and check, or like, can you call up there and say?
Because we're not continuing their care. It's a HIPAA thing.
Okay.
Yeah. I mean, we can always ask.
That's what I was
Yeah.
meaning was like being
It's
able
not
to,
like we go down there and follow up. I mean, some of our staff float, so they could probably see the patient down there and see how they're doing.
okay.
Yeah.
So you get maybe a general idea.
Yeah.
So back to those kids though, because when adults process trauma, we have things that we have to do afterwards, which is when you were saying that they don't follow up. Immediately what I thought of was like, they still have bills to pay. They still have,
I know.
depending on what their situation is. So like, it's so easy to push off all of that stuff. Whereas with kids, like the world is ending or this is being forced on me.
Yeah.
Like it seems like they're two completely different ways of processing what's going on. Like, so, I mean, how do you explain to a kid or, try to help somebody who's like Layla's age, that what they went through isn't their fault or that it's not going to be forever. You know what I mean? Like,
Oh, yeah.
how do you de-escalate a child that has been exposed to that crap?
Just listening to them. I don't know. It's hard. I can't say that's not your fault. Like, you just talk it through and help them with like coping with it. I don't know. Let them talk it through.
Oh, that's interesting. Why would you not say,
Well, let's just cut this whole part out. You can't tell someone that's not your fault. I mean, ideally, it's not their fault.
well, I don't understand why though. Like if a kid's parents were harming them,
Yeah.
that's not on the kid.
Okay. Well,
That's-
when you
that's
say
what
it
I
like
mean.
that, I thought you were saying like your depression's not your fault.
Oh, no.
So we're talking about like the traumatic event.
Yes. Yeah, that's why I was saying.
I
Like,
thought you were like, we were on this whole mental health thing, and I can't tell someone their depression's not their. That's a really weird thing to say.
yeah, not at all what I was
No.
saying. So the situation that I was describing before was like so an adult, when they hear tires screech, they could be out for a week, like hiding in their apartment because of.
Yeah. Kids
Whereas-
have a different type of resiliency. It's
Okay.
very interesting. Working with child and adolescents, you hear horrific things, especially because they're little people and they don't like, it's awful. And then you're a mandated reporter on top of that. So you have to report the things that you hear. And then you hope that by reporting it doesn't cause a bigger issue in the end. Like eventually these children, they go back to where they live most of the time, and social work follows up with what you reported, and you just hope it's a situation that is handled well. And I don't see that side of things. I've done plenty of reports in when I worked in the emergency room and did assessments, and we would get letters back from the county, and they would let you know if they're looking further into it or if they've looked into it and there's no concern.
It's weird to me how many like steps and how much red tape there is around all this stuff. Like even just now getting scared that I was generalizing like mental health in that format. Like
Yeah.
it shouldn't be that way. It shouldn't be scary to like, it's just frustrating. I was just talking to somebody about this a couple days ago about how like being on that unit and knowing that 70% of the employees were floating nurses. So there's no like.
I know when you say floating nurses, the longer I co-work with someone who is actually a float nurse. The thing with the floating nurses, they're not like the group of nurses, they pick mental health as somewhere they want to work. So they have a list of places they're trained and want to work. So it's not like, I mean, I get it. They're not there regularly.
But the nurses that I spoke with, that was not the case. The ones that I talked to were like, I'm usually doing this, but I saw an opening, so I took hours.
Yeah.
You know what I mean? Like,
But they still want to be there. They still want to be there.
but it feels like they wanted the hours more than they wanted
Yeah.
to be there specifically.
But
Wh-
also
like
they
when you're
need to-
using verbiage that says I saw an opening.
Yeah. But they have to be trained there. They have to have that
okay.
training. So they have to say that they're interested in it. There are plenty of float nurses at the hospital.
You're talking about how like they they
Yep.
fill out that thing that says I'm willing to do like work in
Yep.
this
So then
department.
they have to get trained there. Like I only know all this because we're doing that with our unit now, is trying to get Float Pool to come and work with us. And there's there's nurses that are interested in mental health and want to experience our unit as well. So
Oh
we
my
have to-
God, I completely forgot. Finish your thing, but I have something fantastic to tell you afterwards.
So they have to want to work there. And there are great float nurses at the hospital that really enjoy mental health, but they also like the other experiences, which is nice. And I'm going to say it as a mental health nurse, I have not worked medical for so long that I would be so confused if I went to a med surg unit right now where my expertise is mental health, where I think float nurses are great because they really enjoy mental health, but then they have they still keep all their other nursing skills because they work in other different units. And what's great about that is, believe it or not, there are mental health patients on a med surg unit because 1 in 3 people have mental health. So they're able to deliver a different type of care to mental health patients on med surg units or whatever unit they come from. I'm not saying that all nurses don't, but when you have that knack for wanting to work with people with mental health, you have a different kind of compassion or empathy for them.
So I spoke with somebody. Actually, it must have been yesterday. A lady that is when she graduates nursing school, because she went from. Is there something before CNA?
No.
I didn't think so.
There's a nursing assistant. Is she an LPN?
She's an LPN now, but so she's getting tattoos that represent CNA, LPN, and then RN. But there was a fourth one that she was.
Was it a TMA?
Yes. So those 4 things she's getting tattoos for. And I asked what, she's going to school for. And it wasn't mental health, but because what's it called when students go into the hospital?
Clinicals.
So she was doing clinicals, and the person that was leading them asked if anybody wanted to go to the empath unit. And only one person said that they wanted to go. She went and said it was amazing. And like she was so interested in what you guys were doing that she called it must have been her teacher or something, and said, "Is it okay if I stick around longer?" Do you remember a student like hanging around
It's so
longer?
hard. No, we have students all the time. It's so hard to pay attention.
But this was this would have been within like a week. But this lady was super interested and stayed longer than a student normally would.
Okay.
To be able to see more of like what the impact.
Yeah, it's a new unit. It's a new model of care that has, very small amounts in the United States are doing it. So it's a completely new model of care.
But I wanted you to know that this person absolutely
when
had
she graduates, send her my way. Because
experience.
I'm glad she had a positive experience.
Yeah.
I hope that. I think people have a certain image in their head what inpatient looks like, and even like inpatient's not what you see in movies. Like I think people still have that whole like it's white walls, padded walls, this and that, and it's not like that. And I think I really enjoyed my first year of nursing school because my instructor said, "Who is interested in mental health?" And then there's lonely little me raising my hand in a class of 30 some of us nursing students. And she goes, "Well, joke's on you guys because it doesn't matter where you're going to work because you will see mental health everywhere."
That's right.
And then when I worked in labor and delivery, when I did my clinicals in labor and delivery, I had a mom who was delivered and had a history of mental health. And like, it's just like, I'm like, everywhere I go, it's just there. It's like, you're right. It's everywhere we go. And I don't remember who I was recently talking to. We were talking about treating the whole person. And the thing is your physical health will never be good if your mental health is not well. Like you have to holistically look at the entire person, and your mental health isn't going to be well if your physical health's not well. It's like they encompass each other. You need to work on them both. I think that's why there's a lot of integrative care in clinics now. There's a lot of psychotherapists now in clinics and doing all that because we've come, how long has it taken us to realize, like, especially in a world where I don't know, the last 2 years have been awful. People are struggling, and yeah, we need to and our health isn't well.
It's interesting seeing like this new wave of like openness,
Yeah.
like people because of the pandemic are like, I now realize that I have anxiety. Like people come in and will discuss their medication regimen. And
Oh my gosh, but like growing up, you did not talk about your
Yeah.
being on. Oh my gosh, I remember being on antidepressants when I was 8th grade, 7th grade, 8th grade. And I did not tell anybody I was on antidepressants. Like, did not talk about it.
But now it's like
It's weird if you're not on a med now.
yeah.
Yeah.
One of the people that I work with, his entire family is on Lexapro. So they're like chalking it up to like a genetic thing,
Yeah.
which is
could
super
be.
interesting. Well, I mean, you think about because mice, it's handed down that they're afraid of a shadow that's shaped a certain way.
Yeah.
Like, so I would imagine that the more that we start to understand it and like recognize it, that something must be changing, and then it's passed down, however small of a thing that is.
Yeah.
Same way that like addiction is passed down, like it's got to be mental health stuff has got to.
Oh, for sure. Oh, yeah. I mean, we see it with schizophrenia, you know.
Oh yeah.
We see it with stuff like that. I mean, depression, I'm sure. Like, I know my mom has depression. I have depression. You know, I have anxiety. I don't know if my mom probably has anxiety. My dad probably's got some things, but he's not going to, you know. I think
My guess is social anxiety.
My mom?
No, your dad. Because unless it's something that he knows well, he doesn't want to interact with
Yeah, that's true. Yeah. And I got a little bit of that too. But yeah, I think we also live in a different time where we're learning more about it and we talk about it more. So
Yeah.
thank goodness we're doing it, because then now all our kids, like Layla talks about anxiety. My gosh, I could tell when we were going to your brother's house and we were bringing things there. I've been having these like and it's better. It was better this last week, but the week before it was like just random panic attacks.
Oh.
And there's me trying to analyze, okay, what was I thinking about before? What was going on before? What did I smell before? What did I take? Like all my senses. What was this? What was that? And it was like, couldn't identify anything. Well, that's not true. It started sleeting, but I didn't think about that. I'm like, okay. And I'm like, I could feel myself like having a hard time breathing. My pulse increases, and there's Layla like, it's okay. And she can tell when I'm not well, which is interesting. She's like, it's okay. You have Dad, you have me, you have Landon. And she just kept naming family members, which was really sweet. And she's like, and then she just grabs my hand. It's okay. And she talks about how she gets anxious about things. So I think we just openly talk about it. I think it's going to be good for them to know that it's normal. I mean, our body we have to feel anxiety. That's a fight or flight response. I mean, back when we were, you know, running from freaking bears and trying to live as cave people, like that was our anxiety. Now it's driving in the car when it's sleeting or it's.
Well, it's interesting. Like, it's funny the way that you say that, because in that sense, it's instinct. But because we don't have those things, the wiring is all messed up.
Yeah.
So our brains are like, why does it feel like I'm going to be attacked, even though I'm not actually going to be attacked?
Yeah.
So that I think about that all the time. It's the evolution of how our fight or flight works, because we have so many things that when we were, like you said, cave people, that we needed to survive, but now we don't need those things. So our body is like,
Yeah.
I
don't have to go fight for my food. I can just go to the grocery store and there's food right there. Or I can go through a drive-through and I have food right there.
The funny thing about that, though, is like people have anxiety about going to the grocery store.
Yeah, I don't like going to the grocery store.
So it's funny.
My anxiety is I get in my head and I think people are thinking things about me all the time. I don't know what it is.
I think about you all
I don't know. It's so stupid. You know what's crazy is the masks helped because I'm like, they can't see my face. I feel like I have a lot of body dysmorphia and I judge myself a lot. So I feel like other people see the things that I think I see.
Yep.
And they're just staring at me. And it's interesting because Layla has a little bit of that where she feels like people are always staring at her.
Yeah.
I don't know.
Yeah.
It's weird. That's my grocery store thing too. My other thing is if I don't know what parking's like at a place I'm going to, I'm intensely anxious about it. Like we went on a field trip on Thursday to a hospital I've never been to. Okay, I know they have a parking ramp. And then I go into the parking ramp. Okay, I have a ticket. And then there's all this contract parking. Where's the parking? And so in my head, I'm like, okay, there's no parking. I got to park here. And then the whole time after I parked and I finally got into the building, all I could think about was, what's it when I leave and I have to pay, does it take cards? Do I have enough cash? So then I'm already anxious about having to leave when I'm not leaving for like 2.5 hours. And it's just those things.
Mm-hmm. Yeah.
But not about having a bear coming after me, just parking.
Well, I mean, that goes back to the like lack of control and the ominous thing.
I think
coming.
that's my thing is if I don't have control over a situation, I am so anxious.
Because then it's and then what? So I show up, there's no parking. Now what do I do?
Yeah.
I can't even conceive what I would have to do next. Do I just go home?
Yeah.
And that's like a lot of people do that too. Like Mara was talking about a time where the line was too long and there were a lot of people. So she just decided, I don't need these groceries, and chose to be able to have control and to leave and go home rather than staying for the thing that she actually needed.
Yeah.
So I mean, it obviously affects people in different ways, but I feel like, so that's why like with the traumatic thing, the fact that it can just be triggered and then all of your common sense goes away too.
Because I'm a pretty logical person, and thinking that you're not going to be able to pay getting out and you're going to be trapped. My other thing is being trapped. And maybe that's where it goes with the car wash thing is now I'm trying to get out of this parking ramp and I can't pay. And now there's all these cars behind me and these people are going to be mad at me.
Yeah.
And that's always a thing in my head. I'm like, all these people are going to be mad at me. All these people are looking at me. All these people are thinking things about me. It's so stupid because I don't care.
Well, growing up, you needed help, and you would be thrust into situations where you're being judged, even though you're I don't want to say victim in all of the scenarios, but like generally you're just the person that needs help. But like questions and things that can make you feel ashamed or guilty, even though you didn't do anything, you have zero control, and you have no control. Clearly, like nothing that I can say is going to fix these individuals' perspectives.
Yeah.
Nothing's going to change by talking to them. So I just have to retreat and disassociate, and you know what I mean?
Yeah.
Like as I was saying that, I find that now I get like why because I speak in debate mode a lot, or like from all perspectives or whatever, but I don't associate those things with like a hard stance. You know what I mean?
Yeah.
But because of that, like fear of, well, what does that mean? What comes after this thought? I think that's why you can get defensive in things, is because, wow, why would you say that? Why would we even be thinking of this thing? Because when you were growing up, saying the wrong thing meant that you were going to be made to feel like you're doing something wrong.
Oh, yeah.
Which is, that makes
I think maybe that's where my it's so stupid. I have another severe anxiety about emails. Like, am I going to say the wrong thing in this email? Or like, how is this email going to be read? It's just so ridiculous. It's just an email, but it's like, well, I'm going to say the wrong thing. Someone's going to take it the wrong way. And it's like this persona that I have to say and do the right thing all the time. And it's because, growing up, everything was scrutinized. Yeah. Everything that came out of my mouth was scrutinized by people around me all the time. And I think maybe, and this body dysmorphia stuff, stems from my childhood and being called, fat. for a long time and then, you know, relive in fifth. It's very interesting. I was just telling some of my coworkers when I was in fifth grade, all those boys that drew pictures of me and put me around the classroom, and my teacher didn't take the pictures down. And it's just like, I think all that stuff is just like messed my brain up. Like where it's just, yeah, you look at yourself differently forever.
So there's the ironic thing when we were talking about how kids are resilient before, in the right environment.
Yeah.
In a sense to where if they know that there's somebody there that's on their side, then they feel like they can get through whatever the thing is.
And my mom tried, you know, I had people on my side, but like
but the second that you're away from her,
yeah,
there goes your one person that's on your side.
Yeah.
And it's you against the fucking world.
Yeah. It's interesting. Those boys try to ask me out later, years later.
Sucks to suck, homies.
Sucks to suck, bastards.
But yeah, so like it has a lot to do with environment, like and accessibility. So the more that we do this thing that we've been talking about, which is being more open about what happens to us and why we feel, you know, really anxious when we're in a car wash, or being able to verbalize that stuff to younger generations lets them know that, okay, if they were okay saying that in front of me, then it'll be okay when I feel that.
I think it's just funny because Layla's like, when we were in the car wash, she's like, you're supposed to be the adult here. And she's having a blast. And I'm just like, It's a control thing. I do wonder though, thinking back on trauma, my mom experienced pretty horrific traumas. Like, and I won't expose them. Obviously, that's her life. But things that I could never, ever, I don't think I would ever make it out of. There's no way. And she just kept moving forward because she had to. She kept moving forward because she had to. And I think I always tell people, like, we are cups, right? We can fill ourselves with water, but eventually we're so full that our water is going to start overflowing. Mm-hmm. So unless we're taking out the water out of that cup, so, you know, dealing with our trauma, going to psychotherapy and getting rid of some of that water. If you're not getting rid of some of that water, it's just going to keep filling up. And then eventually you're in your 50s and now you're processing through all this trauma and your cup's overflowing and you never developed those skills to deal with that trauma. And now you're like, holy crap. And I think it's being a parent too. You know, you have kids young and then all of a sudden you're like, holy crap, I went through all this stuff as a child, but you know what? I'm going to take care of these kids until they're older and then we all move out. And now you have to sit and think about all the stuff you've gone through. I cannot even imagine. So I think that's what a lot, and I wonder what I'm going to be like when the kids are gone. Cause even like me and you together and then us, even while our children have been growing, we've experienced trauma together. Yeah. So I always wonder what that's going to be like when they're gone. Am I going to have a crisis of like, holy crap? That's why I try to like process through things. And there are things that I'm still trying to process through. Like, I don't know.
I get what you mean. Something that I say on the show a lot, because there'll be people that'll come in and say when they had a bad parenting situation, they'll say things like they were doing the best that they could, yada yada.
With what? Yeah.
Dealing with shit when they were 9 years old. It's like, so what I say is, it's not your job to make up for what they did. They had a job and they failed in that scenario.
Yeah.
And so speaking as a parent, I have to accept that whatever Landon and Layla want to ask me or what their perception of the situation is or was.
Yeah.
It's on me if I didn't do a good enough job and now it affects them for the rest of their life. So however they need to process it, my job is to just be there.
Yeah.
So they could say, fuck you. You were an absent father. You were all like, you know what I mean? I don't think that I have the right to try to force them to feel otherwise.
Okay.
if they come around and find out that dad had mental health issues, dad had addiction, and they figure it out that way,
Yeah.
great. But if the way that I parented made them feel that way, then I did something wrong, and however they need to process it. So when people are processing trauma and they're talking about it on the show, I'm always like, say it how you felt in that moment.
Yeah.
Say it so that you don't continue to bury it and make it seem like, it happened. Even though now once a week I have a fucking panic attack, like they were doing the best that they could. Like you know me, like I don't feel like the kid should ever be at fault, like in the long run.
Yeah.
So, not that you ever say they were doing the best that they could. I don't think I've ever heard you say that. But
I mean, my mom, she, like I said, she didn't.
Your mom, though, is such a different case because she was conditioned to accept the fact that bad things happen to her. And she just, Julie, you need to get over it.
Yeah.
You know what I mean?
Bad things happen to you all the time. Yeah. And my mom always said if I didn't have bad luck, I'd have no luck. Because bad things consistently happen to her. Like if we want to talk about someone who's experienced the most horrific traumas, it's my mom, and.
But that's the other scary thing, right? So if we treated our kids like, get over it, push through it, like they're just going to think that.
Yeah. And my mom never treated me like that. Never treated me like, just get over it. You need to get over it. Like my mom was always like, you can come talk to me about things. It's weird now because it's things now she's trying to do it as, well, you went through this and it's like, yeah. I already dealt with that. Like I don't like to relive things if I've already like, okay, dealt with that book has been closed. I move forward. Like I'll talk about it, but I don't want to keep reliving things. Like, yep, that happened. Book's closed. I've already processed it, grieved it. I went through the, all of that. It's done. So now I think she wants to, and maybe she has a type of trauma for my traumas. Like as a parent, I can imagine like some of the things that Landon's experienced. I have like some slight trauma from his traumas, like.
Well, moms, and I say moms specifically because traditionally speaking, moms get the brunt of like this bullshit, but the disassociating, like their kids, something happens, they recognize that their child is hurting, but they can't do anything about it. Like there was a lot of generations of that where moms just kind of had to go. So it's more that it's like a POW situation. So like with you and your mom, she's holding you and you're both in the same jail cell, saying she's like, I'm sure in her mind, she was going through all of the shit that she went through and she's holding you going, this is going to be her life. There's nothing we can do about it. And
I think she tried to do a lot of hoping things that she went through, I wouldn't go through. And then when they did happen, I think she was hard on herself. Like,
yeah,
I think we protect our kids the best we can. I was a very difficult teenager. I'm going to say it. She did the best she could, but you can only protect your kids so much. And unfortunately, there's a whole world outside of our house. Like I know I'm going to be hard on myself too. If there are things that happen to our kids that I feel like I could prevent, but there are things that like the situation I was in
But your situation was, you could say you were a difficult teenager because nobody truly was like willing to hear you out and like willing to help you go through all of those things, not on a consistent basis.
Yeah.
I know you had brushes with people that were like, it's going to be okay and whatever, but for the most part, you had a ton of people that were very not understanding, and you're the weird one, or what did you do? How did you end up in this thing? Because no way could it be a grown-up's fault or a boy's fault or any of that shit.
Yeah.
And small towns are super guilty of that. My fucked upness was just parents with best intentions, zero knowledge about mental health.
Yeah.
Zero knowledge about addiction. So like in whatever way it happens, if it's not addressed, and if the child doesn't know that they have support, it's like how my back works, right? So the reason why my back failed out is because my muscles were recruiting in different areas.
Yeah.
So a child, where in like a traditional sense would learn coping skills in this way, they go, well, my parents aren't helping me survive, so I got to figure out how to do it.
Yeah.
So they go and look elsewhere.
And maybe not formulate the best type of coping skills. I have to be really.
Oh, go ahead.
Like I'm gonna pee my pants.
Don't pee pants. It's a great opportunity again to mention BetterHelp.com. All of the things that we talked about when it comes to getting help and having someone to talk to in a traditional sense can still be really tough. I mean, go right now and try to make an appointment with a therapist. You're looking at least a 2-week wait time. Go to BetterHelp.com and you can connect with somebody really quickly. I don't know if our promo code even still works, but DDGD, if you do want to Duck Radio, right? That's what it used to be. Yeah. For the BetterHelp promo. So, like I said, I don't know if the promo code works anymore, but BetterHelp.com is still a massive resource because it can take so long to get help from
for real,
a therapist.
Yeah, there's just
and they have addiction counselors now. They're growing at an astronomical rate. So the amount of staff that they have available is pretty crazy.
Yeah. Super cool.
I think their turnaround is no longer than 48 hours, and someone will be in contact with you.
Wow, my gosh, it's really hard to get people into psychotherapy because it's just not enough resources. That would be great too for rural areas. Rural areas.
What was the Malacca mascot?
Wolves. You're such a jerk. Trauma.
So yeah, what I was saying was kids having to look elsewhere. So troubled teens, a lot of times it's because they don't have, so either they have best intentioned parents who just don't know anything about what they're going through, or they have parents that are like, I've got enough to deal with. I give you food, I give you a place to sleep. That's all I need to provide. You got to figure the rest of that shit out on your own.
Yeah.
That's like more often than not, especially growing up, when you think back on like when you met somebody's parents and you're like, holy shit, like no wonder they do this thing, or no wonder, like, you know what I mean?
Mm-hmm.
I'm sure in your past jobs you dealt with that, where you would meet the parents and go, oh, we don't need to do any more analyzing. It's you. You are the problem. But yeah, it all starts with, I mean, people will rescue any baby animal that crosses their path. Every day on Instagram or TikTok, somebody's rescuing a fucking possum or a raccoon or a baby bird.
Jealous, yeah.
I saw somebody rescue a bee and rehabilitate a bee.
That's
it's
right.
like
The big bumblebee one? Yeah.
I think so. But like, we grasp that fragile things need like care and like need it badly in order to be able to have a chance. But for some reason, if it walks and talks, we think that they have some aspect that they
your frontal lobe, like your frontal lobe is not it's not formed all the way until you're in your 20s.
Yeah.
It's crazy. And I still think the older I get, because I'm so freaking old, as I think like 18-year-olds are technically adults. How are they making decisions? Like, they need to be guided.
Do you know why that is? Why we consider 18s as adults?
Well, I'm sure back in the day, because that's like
it's all has to
life
do with
expectancy.
Well, military too.
Oh, well, yeah.
So if we just need you to be strong enough to fight, and an 18-year-old most of the time had the
not you at 18
athletic whatever. I just would have had an asthma attack.
Yeah.
But so it's like if you, that's what I'm saying is if it looks like you can do the same things that we can, that must mean that you 100% can. But Landon can hold a conversation with a bunch of adults. I would never like send him into the workforce as a 12-year-old.
No.
You know what I mean?
No.
So there's this weird perception of like, just because you look and sound like an adult, that must mean you are an adult. And now I can judge you accordingly. Like Justin Bieber, he was a 13-year-old kid because he was making money. Oh, he makes money, I make money, but he makes more than me? I'm going to judge him and shit on him like he's an adult.
Okay.
Which screwed him up.
Yeah. That's all those like Disney. Well, I know Justin Bieber's not Disney, but I feel like a lot of those Disney kids, it was the same.
Teeny boppers.
Yeah. Yeah. I mean, look at Britney.
Yeah. And that goes back, like, just wanting, like, the freedom to say whatever you want and know that you have a community that will be accepting so that you can process the things. Like, I'm sure a lot of the stuff that she does, she's like, she's saying, look at this, but really she's also saying, is this okay? You guys think, am I doing too
Brittany.
much? You know what I mean?
Oh, I know. I psychoanalyze her every post.
But so that's the thing is like, if you don't have the foundation, and thank God you found me because.
Oh my gosh. Oh, I was so troubled before I met you.
I think we helped each other.
Yeah.
It took a fucked up route to get to where we are, but like being able.
I did tell someone our story recently. I'm like, yeah, me and Chris were separated, almost divorced, this and this and that. And what? Yeah. Like I've been processing through my past early life recently, just like on long drives thinking, and it's like, holy crap. Like, whoa. Some of the things that I did or some of the things I experienced, it's like, holy crap. And then it's just, I think it's the mom in me. It's like, oh my gosh, how do I protect like my kids from experiencing these things? Or I can do the best I can. But when they're, when they're adults and you can only shelter. Oh my gosh.
Yeah.
Yeah.
Well, I mean, and yeah, the fact that and it is generational because I don't know, 30 years ago, 20 years ago, you could have raised our kids the same way that your mom raised you, which was kind of like the same thing that's happening to you. I'm going to be there for you, but that shit could happen to me when we wake up in the morning. You know what I mean?
Yeah.
Like the trauma that she experienced is always in the back of her mind because nobody came to her and was like, that's not your fault.
Yeah.
They were like, get over it.
Or it didn't even happen.
Exactly. The gaslighting.
Yeah.
The fact that we experienced the shit that we did and we have perspective on how our parents, their opportunities that they had to deal with it, which was pretty much none. Mm-hmm. And so we have like a window into the absolute wrong way that it should be handled.
Yeah.
And the way that we fucking hope that we are handling it.
Yeah. Yeah.
So
the one thing I worry about is if our children experience the same type of trauma I experienced, is it going to re-trigger me? I worry about that a lot because I feel like I'm a pretty strong person and I'm very resilient and I've coped through things. But I feel like even when I thought I've dealt with things, when I heard a story from a patient when I was working years ago, it like re-triggered everything over again. And I like had to reprocess through it because like the details were so graphic and it was like, oh my gosh, like, because I can bury things. And it was like, oh my gosh. And like the smell started coming back. And actually what's interesting is like the situation I was in, I drive past that place all the time now.
Oh yeah.
And I'm just like, meh, like, but I'm like, gosh, if like one of my children experienced something I did, is it going to re-trigger me? And now I'm going to like spiral. And so I wonder if that happened with my mom, but she didn't talk about it. Like her knowing the stuff that happened, like she knew what happened. She knew like, and I don't know if it like re-triggered her and because she never quite went, processed through it. I don't know.
Yep. I know exactly what you mean.
I like to think that I've developed enough coping skills. I've learned to work through things and know how to work through things. But I mean, I'm not perfect. Like last weekend when all this chaos was happening in this house, I like stayed in bed all weekend and I was like, I'm not going to do anything. And maybe that's okay. Maybe my body was saying you need to slow down because I'm always pushing and always going like, go, 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 go. Maybe my body's like, it's okay to take this one, take back. Like,
well, like with the lice thing, how do you get control back?
I don't know. I still don't think we have control.
That's what I'm saying. Is like your body was 24/7 trying to figure it out and like felt like there's always something that we need to be doing because we still don't have control of the situation. But there's some things that there's nothing we can do but the things that we can do about it.
Yeah.
You know what I mean?
Yeah.
We can do as many of the remedies as we can, but beyond that, that's it. That's all we got.
I know. I don't like that.
It sucks. And
it's a control thing.
Yeah.
Yeah.
Not that it's necessarily an unhealthy one because you don't, you don't want that shit to happen. So you want to know as much as you can about it. But yeah, because of the conditions that we have, it's weird. It's funny. Like there are like my stuff. I was thinking about this just this week because I forget what happened, but I get like a calm for certain situations where I go, what are you going to do? It's just this.
Yeah, I don't like that. I don't like that about you. No, I like that about you, but I wish I had that because I don't have that.
But if somebody is shitty, I'll ruminate on that for a week. Like if I hear somebody talk to somebody else in a bad way, I can't let that go. So it's funny that like for like all hands on deck type of situations.
Yeah, I think I go back to the car thing when you're like, your car won't start, but it's okay. And I'm like, it's not effing okay because this is happening and that's happening. And now it's the car thing.
Oh yeah. That's a perfect example. You're talking about when
my car wouldn't start.
Yeah. And I was just like, wow, what can you do?
Yeah. And I was losing my mind at work because I can't control. I'm not there. I can't see what's going on with the car. I can't do this. I can't do that. And so when we finally jump started it and it worked, it's like, okay, now there's control back. But I felt better when I got home. When I'm in the presence of it, I'm like, maybe I can help fix the situation. It's a control thing. I am a control freak. I don't like it.
But it ties back to trauma. Because if you don't have control,
then everything's going to fall apart.
Or
bad things are going to happen.
Somehow it falls back on you.
Yeah.
If you didn't take control of a situation, how come you didn't do this?
Yeah.
How come you didn't do that? Whereas I got used to, I had my emo phase of like, everything is my fault and I'm yada, yada, yada.
I'm a piece of shit.
I'm a piece of shit.
Yeah.
But now it's very, especially when it's tied to inanimate objects, I just go, you know.
I wish I was more like that. Oh my gosh.
But I wish, it's weird to like recognize that I have codependency issues.
Yeah.
But at the same time, like, I don't really care. I have zero feelings of like wanting to like thoroughly get rid of codependency stuff because it's a huge part of who I am.
Yeah.
It's like you meet somebody who's neurotic.
It's like you don't want to go fix the bumblebee outside. You want to fix the people. Like you're like, come here, get under my wing. I'll help you.
Yeah.
I'm not like that.
You know what it is? Somebody sees the bumblebee. They want to fix the bumblebee. If I know that you can't, then I'm under the wing to say, these things happen. So the emotional state, because the bumblebee is done. There's nothing we can do about that. But the way that you process it, we can do something about that.
Yeah.
So I have a weird, like at the funeral, I was very calm. I cried very little because I was just thinking about like, there's a kid crying. Are they going to need somebody to take that kid? Because like when you're in a Mormon church, if a kid runs down the pew, most of the time, we all knew each other. So if somebody got up and like went walking with that kid, then the parents would just be like, all right, brother Duke has got, you know what I mean? Like
we're very different because then at the funeral, I was thinking of my friend's baby who's going to be born who won't get to meet his grandfather. And then I go through all these things of like, my friend's mom and how is she going to go through her husband's stuff. And like, I just think of like, okay, now what now? What are they going to do now? Like, and I think I also think of like our dads, like, what's it going to look like without our dads? My gosh, we rely on them so much, especially your dad. It's like, call, like if something's happened. I mean, I called my dad 3 weeks ago now, and I called him crying saying I wanted to move back home and I didn't want to be an adult anymore because I was tired of it. And it's like we call them for so much, and it's like, what's it going to look like when that's not there? Like, that is terrifying to me. And so it's like, I think that's where my head goes to, is like, when you see a good friend of yours experiencing a loss, like a parent, and it's now this is the second person in the last couple months who I know a parent's passed away around my dad's age. It's becoming more real. Like,
oh yeah.
It's eventually that's going to happen. And I don't deal with death well.
Yeah.
Because I don't know what I feel about death. Like, what do I think happens after death? I don't know. Like, I respect people who believe in eternity and that when they die that there's another thing after, because I feel like that gives them peace, whereas I'm such an uncertain person, I don't feel peace because I don't know.
Well, you don't have control over what happens after you.
Kim is a control freak. I don't. Yeah.
I keep saying that though because it's an absence of security. If you don't have control, that it doesn't mean that you want to be the boss of everything.
No, gosh, no. I hate being a boss.
There's a misconception with like the whole control freak thing, because it's thrown at women all the time too. Like,
yeah.
So there's this odd, for some reason, you're responsible.
I think it's
for being
growing up in a
responsible.
life that was so out of control that the only way I can deal with things is if I have absolute control over it. Like, if I were to allow you to plan our vacation, I would not feel comfortable. Not that I didn't think that you could do it all, because I know you could figure it out and do it all.
Yeah.
It's because I don't know what's happening and I don't have it in my hands.
There's a Airbnb and we all get Vespas. And
I just read all this stuff about Airbnbs and how they're really expensive and people aren't going for them anymore. And how it's taken a lot of rental properties away from people who could use it. I don't know.
Oh,
it's a Twitter thing, I guess. I don't have a Twitter, but
yeah, I also do not Twitters.
Although I would love not having control driving because I hate driving.
Oh,
that's where I'm fine, where it's like, I know you got it. I don't want to do it.
Yeah.
That's the only thing I can think of.
Yeah. Well, because it doesn't, I don't get fearful. I get angry.
Yeah.
Which is a favorable thing. Like Dad getting mad that this thing is happening while in the vehicle is different from Dad panicking, having to pull over and, you know what I mean? Like, how do we calm him down? No, Dad's just going to be pissed off for 10 minutes or whatever while we go and while we're going to the place. We're still going to get there.
Mm-hmm.
Yeah.
Yeah.
So all of this is like to say that like there doesn't seem to be any like one answer or like any true way to like rid yourself of trauma.
I think what we need to tell people is that I lost my train of thought.
That's okay.
To never not validate someone's trauma. Make them feel invalid. Whatever you experience, that is your experience. No one can say, yeah, well, and I know I'm good at you always have to remind me that like that's your experience, but well, at least I'm not over in Ukraine right now.
Oh, yeah.
My panic attack that I had a week ago, that is valid to me, even though I am not running for my life right now. That is horrific. Mm-hmm. But your experiences are valid. And sometimes I feel like people do try to take that away and from themselves. I'm good at that where I'm like, oh my gosh, yeah, but I try and I do, this is how I go through things. It's like, I have a house, I have a job, I have a family. Like I have to constantly say these things to like reground myself.
Oh, sure.
But it's like, but it's okay that I am still freaking out about how I'm feeling.
Yeah.
but never compare your trauma. I think people are really good at comparing themselves to other people. Like, yeah, I say my mom has had a lot of trauma in her life, but I've experienced a lot of trauma too.
Yeah.
And you have as well. And people experience different types of trauma, and just to validate people when they're talking about it. That's it. That's where I was trying to go. I lost. Woof.
Well, I mean, I was going to say that's like, there's a lot that I don't believe in. So when I hear people talk about certain things, my brain goes, yeah, but you're missing how important like the things that actually happen on a daily basis are. Like people getting super worked up about spirits and shit like that. Like there are people who like, they're engulfed in the fact that there may be a ghost in this house that they're in, or you know what I mean? Like people genuinely get wrapped up in that shit. And for as free, hippie, whatever as I am, I have these objective things that it's like, you can be a hippie dork like me if you have to take the objective things with you. You know what I mean? Like objectively speaking, that the odds of that car wash killing you, very, very, very small.
Can happen though.
It can happen for sure. But so looking at those objective things and going, if it does happen, some pretty like exceptional circumstances must be in place for that to happen.
Yeah.
And as far as I can tell going in here, none of those appear to be in place. But if
my car could just die. Water could hit it in some place that it shouldn't hit, and then it dies. See?
Yeah.
That's catastrophizing. I'm Captain Catastrophizer.
But that same thing, like when it comes to the supernatural.
We're not going to go there. I'm going on a ghost tour in a couple months. I
know. And that's fine. I still say, like, if somebody
don't
freaked out.
Not validate. Oh.
Let me speak.
Oh, okay.
So if somebody says that they had a ghost experience and it still affects them to this day, like they get the chills or whatever happened in that span of like 5 minutes was your reality right then. You know what I mean? Mm-hmm. Your body was responding and doing all of the things because that's legit. You can't affect your passive survival skills.
Yeah.
Your body is going to say, something's not right. We need to get the fuck out of here, or we need to be like assessing, and is something coming after us? Like you have no control over that.
Yeah.
On like a biological level, really. So that's how I validate it. It doesn't matter that I know for sure that it didn't happen, because the way that your body took that in, now you have trauma. Yeah. Now you have this scary thing that hits you. So the reason why I'm saying all of this is because it's something that we try so hard to solve these problems, depression, anxiety, all of these things. If you are allowing yourself to think this way, it's going to prevent you from making that progress.
Yeah.
So that's what I was saying is like when it comes to certain things that the odds are absolutely astronomically stacked against that thing happening, let it go. Look at the other things and say, the same way that we just went through how you process trauma, why you are labeled control freak. It's not because you want to be the boss thing. It's not, there's genuine reasons why you are this way. There are genuine reasons why X amount of things happened, and they don't have to be something phantasmic that you have zero control over.
Yeah.
We need more answers. And going through addiction had a huge role in that. If I were to just look at it from a feelings perspective, my addiction, I probably would have relapsed by now, because I, on a daily basis, am not great. Like, you know what I mean? Like, we all have anxiety. We all have things that where areas where we think we're lacking.
Mm-hmm.
So if I just continued to say, okay, I need to fix it, but I haven't fixed it, that means I'm a horrible person, and just went at it that way, and that's the only way that I'm going to solve my addiction,
Yeah.
I'd be fucked. But having the objective thing allows me to go, I know why I want to do that thing. I know why when my friends talk about their favorite beers and all of these things, why I get that sensation back in my mouth and things like that.
No.
It doesn't mean that I'm a shitty person because I think that way. It's just how my brain operates.
Yeah.
And all I can do is accept that fact and go, that doesn't mean that now I have to go and do that thing.
I see what you're saying.
So not everything, like there are coincidences. There are like trillions and trillions of opportunities for crazy things to happen. Allow yourself to go, mathematically speaking, yeah, it is possible that this thing could have happened in this succinct way that make it look like Jesus is taking a piss on the city of Brazil or the country of Brazil, because there's that giant statue.
Oh, okay.
In Sao Paulo. Do you know what I mean?
Mm-hmm.
There's a reason why it looks like Mother Mary is crying blood, and it's not blood. But circumstances can arise. We've been alive for a long time. Humans have been here for a long time.
So long.
The Earth does super weird shit. Dinosaurs? Are you kidding me? I know, like we have that inside joke, but dinosaurs, really?
I know.
That's fucking insane that they existed. That's crazy.
That
They look like nothing that.
Well, ostriches, crocodiles.
But in their true form, the sheer size of those things is nuts. So, of course, there's all kinds of like wild stuff that can happen, but it doesn't mean it's magic.
I mean, Layla did show us a magic trick last night.
She did show us a magic trick, and Andy and I still can't figure it out.
I figured it out and I can do it, but...
Do we have a hair tie handy? I mean, we went in a couple of different directions, but all of the things that we talked about can have an effect on how you process trauma and whether your support system or community gives you an opportunity to be able to express those things and process through your trauma. So all of the things that we talked about are relatively still within the realm of trauma. Do we have an answer as to why it sticks around? No, not really. We have answers as to how you can live with that thing. Same way somebody lives with diabetes or, any other illness. Like trauma is a real thing that can latch on and stick around for a long time.
Yeah.
So there are things that it's not something that you should just ignore.
No.
Is the main
Like I
takeaway.
said, go back to the cup thing.
It looks like you want to fight me, so maybe put your fist down for a second.
It's like the cup thing. Like eventually,
what you should say is a bathtub. You need to get clean.
I like the cup.
You have to fill the bathtub, but if you don't turn it off in time,
It's going to overflow.
it's going to overflow. Not only that, it's going to keep overflowing. And even though it's chaotic and crazy, you can still turn off that faucet.
Yeah. See a psychotherapist.
See a psychotherapist. Go to BetterHelp.com.
Talk to somebody.
Monster resource that we didn't have for a very long time.
Yeah. Talk to somebody. Work through it. Figure out what helps you. And the thing is you are going to be exposed to things that may bring that trauma back up. But you might be able to, when you get to a place where you can process through it and talk through it or think through it, and it doesn't necessarily cause that fight or flight response anymore, and you're able to just talk about it. I think that was the weirdest thing too, is when you would have conversations with people and they would tell you these messed up things. You're like, what the crap? And you're freaking out and you're thinking, why is this person not freaking out? It's because they finally processed through it and that doesn't cause that fight or flight. And now it's just something that has happened to them.
I freak out when they don't consider it trauma. When somebody tells me a story And they go, really, the only thing that happened to me is my mom got stabbed in front of me when I was 8 years old. But that's not, I'm fine.
Yeah.
It's like, no, you're disassociating or like making it something else. I bet.
But that's how they cope, by not calling it a trauma.
Yeah. Some people are able to do that. But it always scares me because it could very easily turn into like now everybody's an enemy and at any point somebody could fucking stab me.
Yeah.
So
at any point anyone can stab anyone.
It's true.
We all have it in us.
Do we?
Oh, for sure. I talk about that all the time because people are always talking about like they have a risk for violence. They have a risk for aggression. Oh my gosh, you put me in the right situation, I can be violent and I can be aggressive. We all have it in us.
Yeah.
It's built in us somewhere. If someone was going after my children, you damn well I am going to be aggressive and violent.
Yeah, but that's not considered aggression and violence, really. It's considered defense.
So
but I get what you're saying. Like it is an environmental thing.
yeah. Anyway,
which
we're gonna
goes
keep.
back
We
to
can
that.
keep going on. Let's wrap this
We
up.
could go on forever and ever. Okay, I want to focus on the magic trick though before we end, or as we end. So, to the listeners, the takeaway I hope is that look for a good support system.
Develop healthy coping skills.
If somebody is talking to you and does not validate your feelings, then you need to talk to somebody else who will validate those feelings because it's important.
Mm-hmm.
If you're not processing it and you think that you shouldn't process it because somebody made you feel ashamed of that thing, that's not fair to you to just go, oh, I guess it's just me.
Yeah.
So Kim, is there any advice that you would like to impart?
Look for coping skills. Figure out what works best for you. It's not always the same for everyone. People talk a lot about all these coping skills like deep breathing, all that. Deep breathing actually makes my anxiety a lot worse because I'm so focused on breathing and I don't think I'm breathing right. But music works for me. Reading works for me.
I've never even thought of this. Where do you look for coping skills?
If you're interested, I know I have a sheet of 99 coping skills.
Oh.
So I like to give that out because then you can look through it and there are things that you didn't think was a coping skill. You're like, oh, I do that. Baths. I like to take baths.
Mm-hmm.
Sometimes my Peloton. There's music. A lot of times it is music or just like escaping my brain into a show.
Oh, yeah.
People take naps, essential oils. I mean, different things.
That's good, though. Google 99 coping skills.
Yep.
Yeah, absolutely.
Yep.
Great advice. Okay, well, Mama, thank you for doing this.
No, thanks for having me.
I love you.
I love you.
I appreciate you.
I appreciate you.
I'm glad you didn't die in that car wash. Thank you again. And to the listeners, be well to yourselves and enjoy this magic trick. I'll do like a horn or something.